Hello everybody and welcome to Coastal Experts. Today I'm happy to have with me Dr. Banjoko, who is a psychiatrist and also the medical director at Horizon Behavioral Health. Thanks so much for being with us, Dr. Banjoko. It's always great to see you.
Thanks, Natalie.
So we're talking about TMS therapy today, and I know for some of our viewers that may be something that they're not familiar with. Can you define TMS therapy? What is it?
Thank you. TMS stands for transcranial magnetic stimulation. It is a novel and non-invasive form of treatment for severe depression. It uses magnetic energy to treat depression.
And this is something that is not really new. It's been in other countries offered for a while now. But again, like TMS therapy, how does it actually work?
It uses MRI technology, which is a magnet, to create magnetic fields, and that is targeted towards some specific parts of the brain that is believed to be responsible for emotions. They call that the limbic system. And then it stimulates the neurons in that place, and the action has been shown to improve mood in people who have depression.
So there are a lot of antidepressant medications out there, and some can be tolerated, some cannot. Is this a good alternative for an individual who may not be able to tolerate antidepressant medications?
It is actually one, you can do it while you're taking medication. Mm-hmm. The effect can be additive. Two, is you can also do it without medication. Okay. Some of the indications for TMS will be one, treatment-resistant depression. That means you've had depression for a long time, you've tried several different medications, you've tried cognitive behavioral therapy and other forms of therapy out there, and still you are impaired in your day-to-day functioning at home, at work, or in other situations. And TMS has been shown to be very effective in treating those people.
So we're talking about TMS therapy. Let me ask you this, is TMS therapy like electroconvulsive therapy, which of course we all know as shock therapy, and a lot of people fear that?
TMS is completely different from electric shock treatment. It uses the same technology as the common MRI we use, and that is magnetic energy. It uses these to stimulate neurons in parts of the brain believed to be responsible for emotions like depression, irritability, anxiety, and this has been shown to improve depression. The effect has been shown to improve depression, really. It doesn't cause seizures. Actually, with the 10,000 treatments that were given to people during the clinical trial, there was no single reported episode of seizure. It has a lower risk of seizure compared to medications.
That's
really
amazing. How long does the antidepressant effect last?
The Neurostar TMS therapy, which is the one we use, was the one that studied, that did the clinical trial for treatment of depression with TMS in the US. And they found out that 1 year after the completion of treatment, 2 out of every 3 patients reported at least 50% improvement in their functioning.
50%?
1 year after. And even more than about half of those had no symptoms at all. They were in remission. That means they had no depression at all 12 months after.
And can you have dual treatment? So for instance, I guess what I'm asking is, can you take the TMS therapy and take antidepressants along with that?
Yes. Most of the people that were in the trial took they had their medications, they also had a therapy in addition to it. But people who are not able to tolerate antidepressants don't need to take one. So you can do it with or without medication.
Dr. Banjoko, so you guys are seeing some success with this type of therapy, TMS therapy. If there are viewers at home that would like more information, but they're a little overwhelmed and they're maybe a little scared of this type of therapy, what would you say to those individuals?
Number one is education is important. People can educate themselves. You can go on YouTube and put neurostartms.com, and you can also visit us at Horizon Behavioral health. We have 3 locations in the area, one in Savannah, one in Hinesville, and one in Rincon. And we'll be happy to educate you and tell you what TMS does and how it can be of help to you if you haven't seen any significant improvement despite taking medications, doing therapy, or other forms of treatment for depression.
Because it is proven to be a safe and effective treatment, and you guys are seeing it make a difference in a lot of individuals' lives.
Absolutely. It is safe and effective, and I have seen patients that have said, wow, this is exciting. And that is something you rarely see in psychiatry or mental health.
Thanks so much for joining us, Dr. Banjoko. It's always great to see you.
Thank you. It's a pleasure.
If you'd like more information on TMS therapy or you have questions for Dr. Banjoko, all you have to do is go to our Coastal Experts page. You'll find that at wsav.com.